The Cancer Institute of Greenville Health System is not just making progress, it's making breakthroughs. As the largest cancer program in the state, the GHS Cancer Institute combines the latest in diagnostics, treatment, and research with a team of highly skilled clinicians to bring some of the most advanced cancer treatments available anywhere in the world right here to the upstate.
The GHS Cancer Institute has evolved the programs and the offerings such that there really is very little need to leave the upstate to get your cancer care. And in point of fact, we have become a destination for patients both nationally and internationally. We've been fortunate to put together a very comprehensive group of cancer specialists, and our single purpose is to remain true to our mission that this remain patient-centered care. Patient-centered really means that all that we do and think centers on the day-to-day care of a patient so that they feel that they are integrally involved with the decision-making, the planning, and all the supportive care services which surround premier state-of-the-art care.
One example of patient-centered care is the Multidisciplinary Center, or MDC. The MDC offers a unique approach to cancer treatment that involves bringing a team of physicians and clinicians together to streamline care and help patients accomplish in one visit what previously may have taken weeks.
In the old days, breast cancer care used to be a little bit like an assembly line. Patients were moved from one part of the assembly process to the next, one doctor to the next, each picking up where the last had left off. We kind of understand now that breast cancer care is much more complicated and requires a team approach throughout the process. So when faced with a new diagnosis of breast cancer, our patients are met by the team, which includes a surgical oncologist, a medical oncologist, and a radiation therapist. We also have them meet with our nurse navigators, who literally navigate the patients through this complicated and often daunting process of finding out about cancer, learning treatment options, and then finally picking treatment options and going through those treatments.
To hear the word cancer is very fearful. All patients, no matter if it's pre-cancer or the worst of cancers, there's just a big fear with the word cancer. And what the nurse navigator does is help the patient to move to the next step of let's get this done or let's find this out. But we're there to reassure them that we will do all we can to make their outcome the best it can be.
The unique thing that I found out here, I could have a conversation with everyone who was aware of my condition, and they would give me the best formula to help me continue to move forward. Everyone comes together to know what's going on with you, to make sure you get the best plan for you personally. And that's the one thing that I enjoyed was I felt like I'm an individual and not a group. And the people here make you feel that way, to say you're not alone, you are an individual, but we're here to help you and back you up to go through what you need to go through.
When it comes to cancer treatment, one size doesn't fit all anymore. People aren't alike, and neither are their cancers. At the Institute for Translational Oncology Research, or ITOR, researchers are working on ways to speed the development of new medications to treat your cancer rather than your type of cancer, and give hope to those who have exhausted all other methods of treatment.
We've really moved beyond the paradigm that we're going to treat a cancer based on its name. Obviously, we're going to take care of people with breast cancer approved medications whenever possible. But I think we're realizing that almost everybody reaches a point where the standard medications are no longer effective. And it's in this setting where choosing a medicine based on the mutations or the changes in the genetic code of the cancer may offer hope where you didn't know hope existed before. One of the items that distinguishes ITOR from many other research centers is the fact that we have genetic sequencing on site, and our goal is to perform some degree of genomic sequencing or interrogation for every single patient who opts to have their cancer surgery here. This gives them a much better chance of being matched to a drug that they might not have realized could be helpful to them.
One of our goals here at the GHS Cancer Institute is to be the architects of the therapies of tomorrow. What that translates into is being at the cutting edge of many different fields of oncology. That includes the revolution in genomics, that includes molecular profiling of malignancies and applying that to day-to-day cancer.
A patient becomes a survivor the moment they are diagnosed with cancer. At the Institute's Center for Integrative Oncology and Survivorship, survivors have access to evidence-based complementary therapies designed to treat their mind, body, and spirit.
The survivorship program helps people get their lives back together and really addresses the different aspects of survivorship so a person can be just as healthy and maybe healthier as a cancer survivor than they were before they got the cancer. At the Center for Integrative Oncology, we address the full range of the person's experience, and this includes mind-body therapies. Exercise is a form of mind-body therapy, but it also includes massage, yoga, acupuncture, and even meditation. These are activities we do to reduce stress, and by reducing stress, we can actually reduce the risk of the cancer coming back.
The Moving On Oncology Rehabilitation Program is one of the center's most popular therapies. The 12-week exercise program is tailored to each patient's individual needs and centers on aerobic conditioning and strength training to help patients overcome debilitating fatigue and improve their quality of life.
Without the Moving On program, I would be a sad case because I would have no hope. I would have nothing to help me move forward.
Support doesn't end when a patient completes treatment. At the GHS Cancer Institute, patients can be followed long after diagnosis and treatment through the Lifetime Clinic.
The Lifetime Clinic is a brand new clinic, and this is a different model than some cancer institutes are employing. And the reason being is that we know we have 14 million survivors, and we know we're going to have 20 million by the year 2020. So in this Lifetime Clinic, we don't just turn patients from when they're done with their treatment to go back to their primary care provider, but we monitor them for life with regard to that cancer, as well as educating them on long-term side effects to look at, and also secondary cancers.
The GHS Cancer Institute is committed to providing comprehensive and compassionate care from diagnosis through treatment and beyond. If you or a loved one need cancer care today or in the future, rest assured that the GHS Cancer Institute will be here to care for you, mind, body, and spirit, and to give you hope on your journey to better health.
The personalization of cancer care is the dream of many for tomorrow, and it is available at the GHS Cancer Institute today.